kidney, how it operates, what is the working principle, and many mathematical model you might have done during this process. But in this class, this is fairly easy, and we will not go to the how to eliminate the disease in kidney. Rather, we will predict the disease in kidney earlier. It is earlier to affecting the kidney diseases. So in this lecture, we will go for photonic sensor method to detect kidney diseases. So next. So what is the function of kidney? Already you might have known that the function of kidney is to removal of waste product. That means whatever waste material, the food we are taking, that has to be processed by this kidney. Removal of excess fluid inside our body. Balance of minerals and chemicals inside our body. Control the blood pressure. Blood pressure is very important when it is related to kidney diseases. So kidney is playing a key role in determining the blood pressure, and it produce or it enhance the RBC production. And to maintain the healthy bones, the kidney must function properly. This is the function of kidney, but you mark one thing, if it is a healthy kidney, what is the function? If the kidney is healthy, then the most important part in the chemical is sodium, potassium, calcium. If it is deposited excessively inside the body, it will give different kind of problem. So kidney will process potassium, sodium and calcium, and removal of water, and it remove the waste products inside the body, and it balance the hormones inside the body. This is also important for kidney. If the kidney do not function properly, then what kind of problem will get for unhealthy people? Fluid overload inside the body, and it evaluate the waste such as urea, creatinine and potassium. You might have heard when it is kidney disease, you will ask what is the level of creatine. So it has to maintain, the kidney has to maintain the creatine level. The change in hormone level, controlling the blood pressure, making red RBC cells, and uptake of calcium. Uptake of calcium is very, because recently I visited one hospital. Uptake of calcium means if the calcium is deposited inside the body, then you will get pain somewhere, either in hand, either in leg, and you might have seen few patients whose legs or hands black in color. That is because of excessive calcium deposited that block the veins inside the body. And the most common cause of kidney failure is if you have diabetes, then there is a possibility of kidney failure. And diabetes is nowadays very common in nature. And high blood pressure, consumption of excess alcohol, then if you have frequent renal this infection, then smoking, these will all cause kidney problem. But not necessary. If you got diabetes, you will get a kidney problem. It is not mandatory that you will get a kidney problem, but maybe there is a chance. If you have high blood pressure, diabetics, everything is get together, then maybe there is a chance you may have a kidney problem. And if you have kidney problem, then it has to be differentiated at different stages. Kidney stage 1, stage 2, stage 3 and stage 4. Stage 3 is again divided into two parts, stage 3A and stage 3B. That we can determine only by flow of blood inside the kidney. So this is the stage 1. If your eGFR remains within the normal range, but other test result suggests sign of kidney damage, that is stage 1. So in stage 1, if purify the blood 90 ml per minute per 1.73 meter square, then the kidney problem is in stage 1. If it goes 60 to 90 ml per minute, then it is a stage 2 kidney problem. And if it is 40 to 30 to 60, then you will have stage 3. As I have mentioned, stage 3 is divided into two parts. If it is 45 to 60, then 3A kidney failure, and 30 to 44 is 3B kidney failure. And if it is from 15 to 30 or 29, then you have stage 4 kidney failure. And if it is less than 15, then ultimately it is a very serious problem inside the kidney. So it is stage 5 kidney failure. So that is what we do, kidney replacement, if it is a stage 5 kidney failure. What are the symptoms for kidney failure? Symptoms of kidney failure is high blood pressure. Then if you are taking enough energy, or you are giving enough energy for breathing, difficult in breathing, then urination problem. If you have low back pain, then also you may have kidney problem. Swelling in the legs and cramp, then you may have some kind of kidney problem. But again, I am telling, if you got this problem, it is not necessary that you will get a kidney problem. Don't afraid of all these things. So the same thing is written here. Maybe some headache, itching in the skin, but most important one thing what I have gone through, because I am not expert, a doctor. So the important thing is, if you have a smell like this, metallic taste in the mouth, then you must check for the kidney test. Okay. And ammonia smell in the nose, unnecessary ammonia smell and metallic taste. And if the kidney problem is there, so we have to go through the world, what is the number throughout the world kidney problem. If you go by country, it is not visible. Russia, because the expert is from Russia, Russia is top in the world. For 1 lakh population, they have around 12,000 kidney patients. So because of that, the research is very, very high in Russia. And we stand fifth in the world. We stand fifth in the world in terms of kidney problem. If kidney problem happens, then what happens? Because we have to go for treatment. Then we have to come to the price. So if you go to the price comparison or cost comparison of kidney transplant in India and other country, the kidney transplant in US cost about 45 lakhs, equivalent to Indian rupees. If the kidney transplant in UK, it cost around 50 lakhs. Kidney transplant in Canada is 32 lakhs, whereas kidney transplant in India is the lowest among all the country, that is 12 lakhs in the world. So these are all data I have taken from Google, some paper and our own paper. So if we spend that much of money, 12 lakh, 50 lakhs, 20 lakh, whatever may be the cost, what is the chance of recovery from the kidney problem? Whether the patient will die or he or she will alive, that is important. So the chance, like the kidney problem is high in Russia, the chance of death is high in India. Even if you go for transplant, the number is very high. We have in 2016, due to kidney problem, we have 2,25,000, roughly around 25,000 people die because of kidney problem in India. And in China, it is 1,75,000. Europe, it is 1,22,000. Patient die due to kidney transplant in 2017. So all these things are related to, if the kidney is infected, you have kidney problem, you have all this, all sort of BP, diabetes, back pain, or from all these things you have. From there you detect that you have a kidney problem. and it would cost 12 lakh in India, and there is a chance that you may not recover completely. The second option comes whether before going for this transplant or treatment, if you can detect the kidney problem beforehand, some kind of sensor which will give you information that you have initial kidney problem. If that information you got, then you can save much means complete money, as well as the economic is weak for a person due to some patient, that is equivalent to the family. Okay, so for that we have to eliminate, or we have to detect that kidney problem initially. So how to detect the kidney problem initially? There are various kind of sensor which detect the chronic kidney diseases in the beginning itself. CKD patient, the type of biosensor you have is electrochemical biosensor, fluorescent biosensor, and calorimetry biosensor. These are all biosensor available to detect the kidney problem, initial stage. And there are some point of care device, that is lateral flow device, microfluidic based analytical device, lab on chip device. These all are device which will, like you might have seen, because the tuberculosis or the veins inside that, you have many liquids flowing through that. If you can measure those flow rate, because it is ultimately related to flow rate, 90, 30, 60, all these things. So if you can measure those flow rates, then you can check initial stage. And what to detect in kidney test? What to detect? You have a sensor, but inside sensor you have many sensors. These are all broad sensors: electrochemical sensor, fluorescence sensor, and calorimetry sensor. These are all broad sensors. But inside this sensor, what you will detect? You can detect serum creatinine. This is one of the component of those blood vessel. Then you have blood urea nitrogen. Then you have albumin, protein. These all are components which are inside the blood. If there is an imbalance of these components, you can tell initially you have initial problem related to kidney. Apart from that, the primary cause of this CKD already I have mentioned, and we have some other test or diagnosis method, that is urine analysis, EGFR estimation. In the last slide I have mentioned physical test, we have biosensor. So we have sensor, many sensors are there. These are categorically means in 3 types, and among that sensor they detect these components which are affecting the kidney function. But when it is a electrochemical sensor, obviously we have to use some kind of chemical. Electrochemical sensor, we have to use some kind of chemical. If in our blood we have some chemical, and we want to try to find out some chemical component inside the blood which will tell about the kidney stages. Apart from that, if you put some external chemicals, then it will affect the properties of the material or the device. If it affects the properties of the device, then the reading may be wrong, slightly wrong. I may not say it is completely wrong, but the external chemical will affect the properties of that device. If it is wrong, then you cannot come to a conclusion. What is the solution for that? We have a sensor, kind of sensor, which is called as photonic sensor. Photonic sensor never use any kind of chemical. As the name suggests, it only pass light through the device. If you pass a light through the device, so it will only interact with the sample. No chemical will interact, light will interact. If light will interact, then the reading will be accurate. So the advantage of this photonic sensor is that the reading will be accurate. Apart from that, like any other test, we we have to take our blood. These all are invasive methods, means we have to give pain to our body to have a test. But non-invasive method is this photonic sensor. And I have mentioned here the ability of this photonic sensor is high sensitivity. You remember these terms: highly sensitive, fast and accurate measurement across wide range of application. This is not limited to kidney diseases. Any kind of diseases, or it may be any kind of application, photonic sensor is equally applicable. And the major advantage of photonic sensor over electronic sensor in their resistance for electromagnetic interference. As I have told you, there is no electromagnetic interference inside the photonic sensor. There is no chemical interference, there is no electromagnetic interference. And photonic sensor is equally good, and it is portable in nature. We can integrate this photonic sensor inside our body. So this is our some of the example of photonic sensor. So optical fiber based sensor, that is fiber gratings, FBG, then interferometer, intensity based sensor, interferometric sensor, SPR sensor. These are all some 1D sensor, 2D sensor. These are all photonic sensors. These are all photonic sensor, and there are some wearable sensors which are designed using photonic material, that is sweat sensor, PPG sensor, oximeter. These all are available in the market. These all are available in the market. Apart from that, we have some integrated photonic sensor like ring resonator, photonic crystal, grating, MZI, Mach-Zehnder interferometer, and we have interferometer and plasmonics. These are all different kind of technique of photonic sensor. And the other kind is, that is meta surface based photonic sensor, that is based on dielectric constant, and another case is chiral metal surface sensor. These all are based on dielectric constant, or refractive index based photonic sensor. If we want to design a photonic sensor, so you must keep in mind these are the few parameters related to sensor. If these parameters are not good enough, then your sensor is also not good. So you remember this parameter. The first parameter is sensitivity. As I have told that photonic sensor is having ultra high sensitivity. What is that meaning? Sensitivity is defined as the ratio of spectral shift in the peak wavelength of transmission spectra to the change in the analyte refractive index, and mathematically sensitivity is change in the shift in wavelength divided by change in refractive index. So if the shift in wavelength, what I mean to say is, you have a normal people or normal patient, a normal person, and you have a patient infected by some disease. You want to test that disease using photonic sensor. So either it is a blood or urine or tear or anything else, you will give to photonic sensor. For normal people, you will get a spectral wavelength. Some wave you will get. That corresponds to a wavelength. And you have a sample which is of an infected person. That sample will give another kind of wavelength. If these two wavelengths are close together, this is good, or they should be far away. Which is good for a sensor? Which is good? We should distinguish good person from the patient. So to distinguish that, the wavelength should be far away from each other. If it is far away from each other, it is good. But if it is different, the wavelength is different, but it is very close, whether it is desirable? No. It should be also distinct, far away and distinct. So that means sensitivity should be high or low is desired. Sensitivity high or low is desired? High, because delta lambda is far away. So if the numerator is high, denominator is low, then you will get the high sensitivity. So sensitivity should be very high for any kind of sensor, not only photonic sensor, any kind of sensor. Then you have figure of merit is the sensing capability of refractive index. This is something, this is sensitivity S divided by FWHM, full wave half maxima. What is that full wave half maxima? I will explain. You remember this FWHM. And this figure of merit should be high or low, because sensitivity we desire high. So figure of merit is related to sensitivity in the numerator side. So this should be also high, since figure of merit should be high. And what about quality factor? Quality factor of a sensor express the selectivity of the sensor, and sharp resonance wavelength is desired to increase the quality factor. Again, if you observe the quality factor, it is the numerator side we have a resonance frequency divided by FWHM. So if you have a sharp resonance frequency, a wavelength, we can have a sinusoidal wave like this, we can have a sinusoidal wave like this, the width will change. This is what we call FWHM, the width will change. So if you have sharp peak with a narrow width, then in that case, this quality factor will be high. So quality factor is high is also desired. Limit of detection is the maximum acceptable performance of the sensor. It is reciprocal of FOM. So figure of merit already we discussed. So it is S by FWHM, and LOD is FWHM by S. So figure of merit high desired, that means LOD is low. We need low LOD. And signal to noise ratio is, again, if you observe, it is change in wavelength divided by FWHM. This is should be also high, because signal part should be remain high compared to noise part. And resolution is this formula, which is should be as low as possible for any kind of sensor. These are all some characteristic of a good sensor. So what we did with this characteristic, and without going to the final stage, transplant or replacement or something else, if we can, as a researcher, if you can detect those patient information, first hand information, not exactly as a doctor, first hand information, if you can give initially to a patient that you have initial diabetic, you are going to affected by diabetic, or you are going to affected by this disease. So if you can give, at least he can take precaution in terms of food, he can visit to a doctor, he can take some medicine. But what the complete course was different. This course is the topic which I am discussing is the beginning stage. So what we did is, we take a ring resonator shape 2D photonic refractive index based sensor to detect diabetic using our tear. From tear, we will detect diabetes. As we know that all the fluid inside our body contains some kind of characteristic. Even if it is tear, it has sugar part, it has salt part. Correct? So what we did is, we have taken a monolayer of MOS2. Then we took a 2D, because it is 2D in nature, so we took X and Y of this sheet, and from so here, this is the radius of the rod, and this is the air gap between this MOS2 air holes, and this is the lattice constant between middle of this hole and middle of this hole. The distance is lattice constant. We have taken this a row and column of MOS2. Then because it has to optimize, we optimize those things. So what we did is, we optimize the radius of the rod against wavelength and lattice constant of the rod against wavelength. So when you optimize, we got this blue line corresponds to lattice constant versus wavelength, and this black line corresponds to wavelength versus radius of the rod. we intersect, or luckily this intersect, because it is a heat and trial method, we are not doing any kind of mathematics here. So we change many times, we change here radius, many distance, many things we did. After all, because this is a suitable solution for us, this intersect at a single point. This should not intersect twice, this line. This intersect at a single point. This give enough information. So that means the intersection corresponds to radius of the rod, and intersection corresponds to lattice constant of the this structure, MOS2. So with this information, what you did is we kept everything same, because as I have told you that in photonics we have to pass light, and the light has to be interact with the analytes sample. So to pass the light, we have removed few MOS2 from here, and we made a input port and output port, and we kept our sample, tear sample here. In the middle, we kept our tear sample. This is actually, this is what the innovation we did with, this is Jay, he is doing. So what he is doing is, this is his paper actually. So what he is doing is, he has removed few air holes and make a C type of shape inside the sensor, and he kept the tear sample in the middle, and he passed the light through the input port and collect the light through the output port. And this light is of 1550 nanometer wavelength. So if you have seen in our laboratory, optical laboratory, those who are in 6th semester, they might have seen some wavelength light is available in the optical lab. Those who are BTech student, it is available in the optical lab. So and this, so this, when you pass through this, if you observe this field intensity distribution in the proposed MOS2, proposed monolayer of MOS2, 2D photonic crystal, when you pass, see, we have a path here, we have closed this with MOS2, but this light is interacting with this sample. See, this is the, so if it interact more, the result will be good. So after interaction, what we have to find out is, I have told you that we have to go for all the characteristic of sensor: sensitivity, figure of merit, quality factor, LOD, resolution, everything we need to calculate. We have calculated all these parameters related to this sensor, because we are trying to find out diabetes from the tear sample. And we have only one sample, one is normal tear sample, and the another one is affected tear sample. So here, when you pass the light through this structure, for normal tear sample, the wavelength is 1600, around 1600 nanometer, and when you kept the infected tear sample, the wavelength is shifted, and it is corresponds to roughly around 1870 nanometer. So if you can observe, the wavelength is far away, 1600 to 1870. This is the delta value. This is the value of delta. And I was talking about FWHM, is luckily we got a sharp peak. So this is what actually, if those who are reading analog electronics, you might have read 3 dB gain. 3 dB gain is nothing but 0.707 intersection. You draw this line, and this is the wavelength. Like that, we have to find out FWHM at a certain point of this and draw a line and tell that that wavelength is FWHM inside that. So we did all these things. After that, we analyze the FWHM versus quality factor. As the relationship is inverse in nature, we have seen that, and it is exactly coming with a cross section, or with a cross. This is quality refractive index versus quality factor is increasing, whereas FWHM is decreasing for the infected sample. We have not stopped here. What you did is, we did another structure to detect some other diseases. So what is that disease? So it is numerical investigation of 2D photonics ZN of 2D functional ZN of photonic sensor to detect urine component, So again, in the last case we have taken MOS2, that was a good material. Now we replaced MOS2 with ZNO. So everything remains same, but we change the application. Detection of urine component. Urine has different component, so we need to detect those component inside the urine using this sample. So the process remains same. We change the radius versus lattice constant, and it intersect here, and we have chosen this lattice constant and radius for this structure. After that, the innovation, after that we pass the light of 1550 nanometer, and we got a optical band gap of this, which is corresponds to 1550 nanometer. And the innovation lies here. Actually everywhere the structure we did, actually we have did another structure, but this is a C type structure. Earlier, if you observe that the sample was kept for tear in a rectangular way, now we have made it hexagonal. The sample structure is hexagonal. This is, if you do this and everything remains same, and we pass the light and collected in the output port and kept our urine here, and you can observe the electric field distribution inside this structure. So the light is interacting better way with the analytes, and this is only the cross sectional view. This is we got, this is the cross sectional view, this is the top view. So we got highest intensity in the analytes parts only. That means the light is interacting better in the analyte part. So after that, we found out the wavelength of different component of urine. Like here, you might have, if it is visible, we found out the glucose concentration inside the urine. Glucose concentration inside the urine means it is diabetic. Correct? So if you can tell about glucose, then it is diabetic inside urine. So what you did is normal sample with 0 to 15 mg per dl. This is the black color. This is the wavelength we observe. After that, we took 0.625 gm per dl. Actually, this is an infected sample. I will tell what is the drawback here. I will tell in the end. So with 0.625 gm per dl, we found out the intensity transmission spectra for this one, and 1.25 gm per dl, this is the transmission spectra. Likewise, we have 6 sample, and for each sample we got transmission spectra along with the normal sample. And we know the formula for all other things that we will discuss afterward. Before that, again we have urea concentration inside our urine. If urea is increased, you might have heard about people, they will tell, I am getting pain in my foot. So that means it is urea is increased. Ultimately, urea is increased. If you got unnecessary, means without any hurt you are getting pain in foot, that means it is urea is increased. So for urea, the normal sample, we took the transmission spectra, and we have 3 more samples for different composition. So we have found out the transmission spectra. And for albumin, albumin you might have heard about during this lecture, 4-day lecture. Albumin, bilirubin, these are all component of your blood. So blood, as well as here you have taken urea. So albumin, we have only one sample. Then we found out the transmission spectrum. Immediately you will get a question, sir, here for glucose you took 5 sample or 6 sample, For urea, you took 3 samples. For albumin, you took only 1 sample. What is the reason? Yes, reason is very simple. Reason is simple. What we are designing or investigating the sensor using the given sample, because as an engineering institute we are not allowed to handle the biomolecules. Correct? Biomolecule is dangerous. Already we heard about corona, all these things. So it has to be handled by some ICMR lab that is given by government of India. So we, for calculating this transmission spectra, we need refractive index of those samples. So refractive index of those sample, any sample I can find out by ellipsometry. Ellipsometry is there, that will give the refractive index. But I need to assess those sample. So I cannot assess. Here there is no chance. There is means many formalities we have to follow to assess those sample. So this already reported values we have taken and we design sensor accordingly. So here the reported value were 6, here 3, here only 1. After that, because nowadays the catchy is machine learning. What is the machine learning? So machine learning, we didn't go the hardcore machine learning, we stopped in regression. So what you did is, we plot those resonance wavelength versus analyte refractive index, and we got this curves, and we put a regression line, a straight line, fitting a straight line, and this straight line is good or bad only can be determined by R square value. When R square value is closer to 1, you will tell it is best fit. If it is less than 1 or downside, there is worst fit. So our R square value for this is 0.95, which is near about 1, it's good. And for this case, it is 99%. That means it is better than that. And we do not go for the R square fit for this one, albumin, because we have only 2 samples. Here we will get 100% R square fit. So this is my last slide. But the drawback, in conclusion, what I can tell is, the drawback is we need to have assess of refractive index of samples. Otherwise, we cannot detect the disease of any patient. Second thing is that after spending so much of money, if you go for treatment and there is no guarantee, better you go for some fast and information or testing to detect those diseases. Third, once one doctor or a nephrologist, only a kidney specialist, he told in a discussion, so he told, like in our, it is his statement, in our every birthday we used to celebrate with 2000, 5000 with cake, all this treatment, we give party to our friends. So he told that when it is your birthday, you go for complete body test with that money. Don't go for celebration, so that you can tell that yes, I'm fine now. Okay. So in that way, so I wish all of you should remain healthy without any problem, no kidney, nothing, no heart, nothing. You should remain healthy and good spirit. Okay, thank you. I will stop here.